This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman in New York. Juan Gonzalez joins us from New Brunswick, New Jersey. Hi, Juan.
Hi, Amy, and welcome to all of our listeners and viewers across the country and around the world.
Well, January marked the deadliest month yet of the coronavirus outbreak in the United States. Black and Latinx people in the United States continue to die from the virus at higher rates. Now, new data shows they're getting vaccinated at much lower rates than white people. The Centers for Disease Control and Prevention reports more than 60% of those vaccinated so far are white, while just 11.5% are Latinx, 6% Asian, and just over 5% Black. This comes as many Black and Latinx people face a disproportionate risk of exposure to COVID in their jobs as essential workers and are more likely to have pre-existing conditions. The CDC data was gathered during the first month of the U.S. vaccination campaign, and race and ethnicity are only known for about half of the nearly 13 million recipients. At a press conference Monday, the head of the Biden administration's Health Equity Task Force said more data is needed. This is Dr. Marcela Nunez-Smith.
We cannot ensure an equitable vaccination program without data to guide us. The CDC will be releasing additional data regarding race and ethnicity and vaccine uptake soon, but I'm worried about how behind we are.
Here in New York City, just 11% of COVID-19 vaccinations so far went to Black people, who represent 24% of the population, and 15% went to the Latinx population, who make up 29% of the city's population, even in predominantly Latinx neighborhoods where vaccination sites reported high numbers of white people from outside the community getting the shot. Mayor Bill de Blasio held a news conference on Sunday and said the disparities are unacceptable.
What we see is a particularly pronounced reality of many more people from white communities getting vaccination than folks from Black and Latino communities.
Across the country in Los Angeles, the number of Latinx patients dying daily from COVID-19 has shot up by 1,000% since November. Latinx people are now succumbing to the disease at a rate over 1.5 times that of all Los Angeles residents. And that's where we go now to speak to Dr. David Hayes Bautista, Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture at the David Geffen School of Medicine at UCLA. Dr. Hayes Bautista, thanks so much for joining us again. 1,000% increase in deaths of the Latinx population in Los Angeles. Can you explain what's happening?
Oh, it's quite simple. What we're seeing illustrated is about 150 years of medical neglect of Latino amongst other communities. And in California, all populations of color have much higher death rates than non-Hispanic white, which tells us a lot about where the medical resources are and aren't. But particularly for Latinos, as essential workers who have kept the state going, the farm workers who kept the state fed, the truck drivers, the packing house workers, the food industry workers, et cetera, the fact that they have worked during the early days of the pandemic, we didn't consider them essential workers. We didn't provide them personal protective equipment. They rarely have health insurance anyway, very low wage, so that the coronavirus was able to eat its way through them very quickly. Your average Latino household across the country has more wage earners per household than non-Hispanic white. So you have more adults leaving the house every morning. They cannot do their jobs from the safety of their living rooms because they don't have those kind of jobs. You cannot grow strawberries in your living room. You cannot pick peaches in your living room. Thus, they become more exposed to coronavirus. They are more likely to bring that into the household. Latinos have twice as many children per household, and children are often asymptomatic. These are the conditions that the coronavirus just loves, is very opportunistic. It's not because they're Latino that the rates are so high. It's because they are in those occupational and living arrangement spaces that coronavirus just loves. A lot of exposure, a lot of people, boom, there it goes. We've been seeing this now for 9 months.
But Dr. Hayes Bautista, that could be understood in terms of the exposure. But now we're dealing with the issue of the vaccinations in terms of being able to prevent future exposures. And it's astounding that these inequities continue. I mean, not just in California and New York, Texas, which is 40% Latino, Latinos represent only 9% of the people who've been vaccinated so far, even though the lower Rio Grande Valley is probably the worst place right now in terms of infections in the entire country. How do you explain the disparities in the vaccination process now?
Well, again, we have to remember these disparities didn't suddenly appear 9 months ago at the beginning of the pandemic. These disparities have been built in decision by decision politically in terms of medical education, where to place medical resources, et cetera. Only now we're seeing them, basically, those chickens come home to roost with the pandemic. Unfortunately, Latinos and other populations of color are paying the price for this maldistribution and limited access to medical resources in any case. So it's just making a bad situation multiplied even worse. The vaccination rate is very, very low in California amongst Latinos and most populations of color. So the very populations that have helped keep the state together, kept it fed. If you remember the early days of the pandemic when people were fighting the grocery stores over paper towels or toilet paper, I keep saying, imagine if you were fighting over the last bag of potatoes in that store. That would have been some serious fighting. Thanks to farm workers, we never got there, but the farm workers have paid a price because we have neglected them consistently for over a century and a half.
And in terms of the recent explosion in deaths, because you did a paper that tallied the high death rates among Latinos between May and November, but since November it's exploded 1,000%. Could you? What's happening there?
Well, that was 1,000% in some areas of Los Angeles. We got 15 million Latinos in California, so we're looking at the state because we realize that in some areas we're doing work in farm working communities in Ventura County, and in those small areas it's just exploded. Overall, between actually October 27th and January 27th, the overall state mortality rate for Latinos has doubled. However, it started in October as 5 to 6 times higher than white, and in January it's still 5 to 6 times higher than white. So that compared to white, yes, the death rate is absolutely huge. And I am not sure yet that we have peaked. I am on the board of a hospital in East LA. 99% of its patients are Latino, and we have had increases in admissions over the past 4 days. We have not seen yet the leveling off that other places may claim to have seen.
Dr. David Hayes Bautista, if you could talk about the issue of language and the issue of the directions that are being given to people. We have two different situations. One, when people get sick, and the other, for people to learn about vaccines and not be afraid they'll be picked up by ICE if they dare to be vaccinated. I wanted to go to an interview we did last month with Odelia Romero, the Zapotec interpreter and co-founder and executive director of the group Indigenous Communities and Leadership, or Cielo, an Indigenous women-led nonprofit in Los Angeles. This is what she said.
When you hear the privilege of others, when the essential workers are not getting vaccinated, it's very heartbreaking, and it's very personally very frustrating. Like, though I wouldn't have the words to tell you like my feeling of anger at times, because I see Indigenous communities at the forefront, from the farm, from the agricultural fields to the restaurant, to the hospitality industry, to the cleaners. We are there, and we don't have access to the vaccine. The loss of lives, people being infected, and the loss of knowledge it's there, right? Some of the elders have passed away, and there goes a whole world view. Just last week, someone in the community died that she knew the stories of migration. She was one of the first women that came to the U.S., and she brought a lot of other women. And all the stories are gone. And the language is dying with COVID more than ever, especially here in L.A. with the elders.
At places like Standing Rock Reservation, Native American leaders have prioritized the language keepers as those to be vaccinated first, those who speak Lakota and Dakota. But this goes to a number of questions. What languages are people being instructed in where to go if they have COVID-19, where to go if they have the vaccine? Also, essential workers being prioritized when it comes to vaccines, not just even getting the vaccine, but the fact that they are on the front lines, whether we're talking about farm workers in the fields, people who work in grocery stores, people who keep the whole society alive every day, somehow being protected and reached out to proactively, as opposed to them figuring out where they can go.
Absolutely. Well, I have to say the bulk of the information is provided in English. Now, we have to remember Spanish. Medical services have been provided in Spanish in California for 251 years. So this is not like something that suddenly happened. This is simply part of California history. And the Spanish spoken in California has been highly indigenous inflected. In 1805, the Spanish spoken here is, yes, it was Spanish, but also included Nahuatl, that is Aztec, Otomi, Lipan, and Comanche as part of the larger spoken language. Indigenous who arrived from Mexico and Central America, however, are not considered Indians by the U.S. government. They're just simply immigrants, are not eligible for service under the Indian Health Service. So they're kind of left out with nothing underneath them except their own communities. We lack interpretation in Spanish, by the way, also in Vietnamese and Filipinic languages and Southeast Asian languages, all underrepresented, much less the indigenous languages, and yet it is the indigenous communities that are increasingly forming the backbone of farm working in California. And our society, our institutions simply hasn't learned how to communicate with the ones who feed them.
And Dr. Hayes Bautista, I'm wondering, in terms of the dissemination of the vaccine, what your thoughts are on the best way to move forward in an equitable fashion. There've been clearly there have been these attempts by some local governments to put everything through existing hospital systems. There have been the attempts to open up arenas or stadiums, basically on a not first come, first serve, but in a general shotgun approach. Do you think that there has to be a more directed approach into particular industries and jobs, or by zip code? What would you think is the best way to assure greater equity in vaccination process?
Well, the extent to which we rely on the existing institutions of healthcare delivery, we're in trouble because those existing institutions have not adequately served minority communities in this state for 150 years. However, there are alternative organizations, the community-based clinics, for example, who are a large major provider of healthcare services, particularly in California. We have the community organizations, and also we need to deal with the lingering effects of the Trump administration. Just last Sunday, at a vaccination event at Dodger Stadium, a group of Trumpy supporter anti-vaxxers actually disrupted and caused closure of that effort for over an hour as they're trying to persuade people not to become vaccinated. And by the way, their organizing instructions said, oh, don't bring your Trump flags. We don't want Trump to get any blame for this. So we have very confusing messages. We have confusing priorities. Up until a few weeks ago, essential workers were a priority. Now the state has shifted to elderly. Well, the essential workers are largely minority. Elderly are still largely white baby boomers. So it's a very confusing lack of a plan. But the ones paying the price are the ones who have, for 150 years, kept the state clothed, fed, and functioning.
I wanted to talk about what's happening here in New York. The governor's Department of Health, 9 top leaders of the health department have quit amidst the rift of what he's doing in laying out the vaccine rollout. Bill de Blasio, the mayor, held a news conference Sunday admitting the terrible figures on who actually is getting access to the vaccine. The numbers: 11.5% of the Latinx population, 60% of those getting vaccinated were white, 11.5% Latinx, 6% Asian, just over 5% Black, even as vaccination sites are put into communities of color. Overwhelmingly white people are going to those sites and getting vaccinated. The New York Times today has a major editorial on this disparity and what has to happen. The City newspaper did a very interesting piece talking about the New York Presbyterian Hospital at its Washington Heights Medical Center complex. A Latino woman, Olga, coming up and encountering one language barrier after another. No one there spoke Spanish. The reporter was asked to do the translating for the paper. As she said, we don't have access to internet. We try to make our online reservations. We can't. And then when we get here, no one can help us. What about that issue of these online rollouts of vaccines and who gets access to that and who doesn't?
We've done a couple of studies actually on telemedicine, one particularly on telemedicine and COVID and how these function. And it turns out that most of the telemedicine efforts that we have, for example, out of the School of Medicine, assumes that you have one screen and it's sitting on a desktop with broadband access. A lot of Latino families don't live in that situation. What they tend to use is something like WhatsApp. But our systems don't funnel into WhatsApp, which is something more accessible. So again, we have built up our system on the assumption that everyone behaves kind of like in Beverly Hills, has access to all those wonderful services. Most of the population does not. We didn't even think of that at the beginning of the pandemic. Farm workers didn't receive PPE until even now. Many farm workers do not receive PPE from their employer or from the state. So it followed the admissions committee's decision who gets into the medical schools, who's graduate for the past century, and it has not been primarily communities of color or students of color. And now we're reaping the results of those decisions to reduce medicine to to be able to serve certain communities and just simply ignore the others.
And doctor, what about the situation that segment of the Latino population that is undocumented in terms of access to services, even access to the vaccine? We're told it's supposed to be free, but what's the actual situation from what you can tell?
The message once again is horribly confusing. Is it free? Is it not? Do you go to a county facility? Do you go to a private facility? Will you get a bill? Will you have insurance? Will you be considered having used public facilities if you get a shot? The messages are very, very confusing. And for a lot of folks, given that it's already difficult to find a physician who speaks your language that you can pay if you don't have insurance, much less than the idea of, is this going to be a public charge again? So I can understand why people are really confused. And in the best of cases, the best thing to do, they think, is, well, do nothing. How can it get worse? Well, it can. COVID spreads like a communicable disease, but it kills like a chronic disease. It's very different.
Dr. David Hayes Bautista, can you talk about the protest at Dodger Stadium over the weekend, the COVID-19 vaccination center, one of the biggest in the country, being shut down temporarily by people who are against vaccines and also the far right? The significance of this and what messages are the Latinx community getting around the safety of these vaccines?
Well, among others, and I was not there, so I'm relying on other reports that I'm getting from people who were, is that this also included this Free Mask or Mask-Free California Coalition. They've come together, and apparently about 2 weeks ago, they went through the Beverly Center, which is a very upscale shopping center right at the edge of Beverly Hills, and in groups entered stores without masks, got in a shouting match. There were tug of wars, etc. So it's not aimed only at Latinos, but there is this very strong element of resistance to doing any public health measure as an infringement upon their freedoms. And I keep saying, well, you have every freedom to kill yourself by not wearing a mask. You do not have the freedom to kill me by breathing your germs on me. And that message has not gone through. And of course, it's being stimulated by the remnants of the Trump administration. So once again, we have a very confusing situation. People were waiting in cars to get vaccinated. I have heard that some finally got frustrated and they left the line, so they've lost a chance for a vaccination. So again, because we did not have a strong plan from the federal government for 9 months. In fact, we had an administration that basically turned its back and said it was a hoax and it was going to go away, which it has not. is left to the states. Many states leave things up to the counties. It is horribly confusing, although the one consistent message that many undocumented have heard is use public services. You can never become a citizen, even though you fed us during the pandemic.
And is there fear about ICE picking them up if they get on a vaccine line?
I don't know about a vaccine line, but there was a story earlier this summer out of Denver that was in the Spanish language medium about a COVID positive person who was undocumented, was actually admitted to a hospital in Colorado. ICE went in and picked him out. I don't know what happened, but ICE has been sending a known coronavirus positive refugees back to the countries of origin, Mexico and Central America, thereby seeding the pandemic in the countries with the least resources to respond to the pandemic.